and also AI companion. Okay, starting now. Remote patient monitoring used to mean watching from a distance. Today, it means acting in real time. Just collecting data is not enough anymore. You have to rewrite the rules of care delivery by turning passive observation into proactive intervention. Hi, this is Pankaj Gupta from Mytho Venture Partners. We are a deep tech revenue scaler and fund based in Singapore with approximately 120 portfolio startups. We are excited to welcome a panel of global healthcare leaders who will explore the cutting edge technologies, evolving policies, and regulatory framework that are revolutionizing remote patient monitoring, transforming it from a reactive tool into a proactive engine for better outcome, greater access, and smarter care delivery. To start with the introductions of our esteemed panelists, I would request Sanjay to do a quick 30 seconds introduction. Sanjay, please.
Thanks, Pankaj. Hello, everybody. Great to be here this morning. My name's Sanjay. I work from the UK and very much working with startup organizations in the health tech sector, looking at their strategic direction, their opportunities, and preparing them for their market ahead, and across all different therapy areas and sector conditions. And yeah, excited to be here and add value to this conversation. So yeah, I look forward to everybody's thoughts. Thank you.
Fantastic. Thanks a lot, Sanjay, for your time today. I'm sure we are going to get a lot of interesting insights from you, especially from the European perspective. Really appreciate it. Mickey, may I request you to go next, please?
Yes, I'm Mickey Raviv. I'm founder and CEO of Vital Health, a serious entrepreneur. This is my fourth project. The previous three were done transformation in some areas, and all of them were acquired.
Fantastic. Thanks a lot, Mickey. So probably you can also talk about healthcare and how to make money through different startup exits. So thanks a lot for joining us today. Larry, may I request you to go next, please?
Good morning, all. Nice to see you all. My name is Larry Koyama. I'm based in London, UK. I've got a fairly mixed portfolio. I guess my main, one of my main areas of work at the moment is working in healthcare innovation within the NHS system, and largely that is around how we support innovators to be able to be adopted and scaled within a complex health system like the NHS. Happy to be here.
Thanks a lot, Larry. And I do understand that NHS is pretty innovation friendly, evaluating a lot of different healthcare solutions. So I'm sure that you will have a lot of insights on NHS perspective. So really appreciate that. Brian, may I request you to go next, please?
Definitely. Thank you. Brian Yam, Chief Operating Officer of Somnology. We are a digital sleep therapeutics company. We work a lot with the professional sports teams located within the United States, as well as we are starting to look at the professional sports teams located within Japan, as well as the UK. Another area that we are highly in is the U.S. Armed Forces, and we do a lot of work with U.S. veterans. So thank you very much, and excited to present today.
Thank you. Thanks a lot, Brian. And I'm sure that we will have a lot of interesting insights from you as well on the US healthcare ecosystem. So really appreciate that. Now I would request Venkat, moderator of the event, to introduce himself. And I know that he prepared some really interesting, heart-burning questions that he's going to ask you and get your insights on. So please, Venkat, go ahead. The floor is yours.
Thank you very much. In fact, I'm really impressed with the panel and the wide range of experience which people have. And so I will try to put this thing into a perspective so that we are actually able to give our audience the right quantum of information, and more importantly, if there are the startups who are also joining in here, they will get a perspective on what they should look for and what they should do. Having said that, just let me introduce myself. I have been in the healthcare industry now for the last 40 years. And I have been in all the segments of the healthcare, whether it is the pharmaceuticals, or whether it is the hospital and healthcare, or diagnostics, health tech, med tech, and so on. So you can call me as the Jack or the Joker in the pack, so I can fit in anywhere from whatever perspective you would like to look at. But then in the last few years has been quite enriching for me in the sense that I moved from the traditional hospital management systems and the healthcare systems to the newer age ones like the health tech, the platform-based health delivery system, and the med tech, which is right now India's sunshine industry, so to say. So everybody is running and rushing to make in India for the world type of thing. And I also would like to, I have four startups in my pocket, which are in various segments of health and medtech. But today's subject, which we are talking, which we are going to talk about, has been there at the back of my mind ever since my days in Apollo, where I was a CEO. And Apollo, incidentally, is the largest healthcare hospital system in India with more than 11,000 beds and so on. But 11,000 beds for India is just nothing. But then we have been constantly working to evolve the system into a little bit more organized way, but then I'm not sure if even half of the distance which requires to be reached. Remote patient monitoring has been one which is very, again, close to my heart, primarily because I've got three patients in my house who need remote patient monitoring because they are actually not patients, but then they are people who require care in some form or the other. And so therefore, the challenges of going to a hospital and the challenges of managing things, I look forward to all as to where and how we can navigate this entire thing on remote patient monitoring and bring it to some substance. So we should be able to take this whole thing forward in a very consolidated and consorted way. So as Pankaj has already talked about a little bit and said that RPM was largely a passive data collection. But today we see that revolution is underway. A lot of technologies are rapidly moving from the simple data transfer to providing proactive, personalized, and predictive care. So what I would like to do today is break up the whole discussion into maybe four different parts or segments, wherein in the first one, we will talk about the technology, focus on AI a little bit, and the predictive analysis and the various algorithms, and some examples, if you may, to that, so that we are in a position to get a comprehensive fact of where AI fits into the remote patient monitoring and how we can use this into it. Then we will talk a little bit on the variables, the innovation in variables, or the clinical integration of that into it, and see if we can get some qualitative information from the available sources which are there, from the available variables which are there, and how the patient access as well as the doctors and the hospitals or the healthcare system can access that to make the lives better. Personalized care and patient engagement is what I talked about and what is very, very important in this. So we will spend some time on that, and one of you can just address that. And lastly, I would like each one of you to give your own perspective on the future of care delivery. Focus on a little bit on economics, the workflow, or the available shift which is happening on the hospitalizations and some efficient ways of the healthcare system to be managed. And what advice would you like to give to the startups, if any, who can then focus their attention on building something in that or looking at the problems which would be there? So I will leave the question open, and each and any one of you can pick that up, so that there is no restriction that we are not giving a syllabus to anybody. So from that perspective. So a very simple basic question is, how is AI fundamentally shifting remote patient monitoring from a reactive data stream to a proactive predictive clinical tool And what do you see as the biggest game changer in terms of patient risk prediction? So either of that in that is one. So anyone would be.
Who wants to take the lead?
Yeah, so I can start, no problem. Thanks for the question. First, as we all know, remote patient monitoring in the history aim was to collect personal data, okay, but also to collect personal data quite accurately, but in I would say a seamless method, which means that the resident, the users will not be involved in the process of collecting the data, but just to approve. But this streaming data, which along the way that is collected, has a minimum value if it is not continuously analyzed, continuously compared to the wide range experience, like the global experience, and come out with a predictive ability to prevent such deterioration. So AI in this manner, open the real-time global ability to collect, the experience, the mass experience, and to help to take a personal decision which improve residents or user care. So that's the key point that I see in this area. Besides, of course, the ease of interaction that has the ecosystem with this valuable data. Like if a user would like to see what's going on, he just ask and he get the answer. Doesn't need now to do deep research, to go to I would say graphs, reports, etc., to decide by himself what's going on. But again, just to ask and the right and correct answer, as simple as that.
Yeah. Anyone would like to substantiate or add 1 or 2 points on that? We are open.
I think I feel that as AI gets implemented more into solutions, we're looking at a very much shift of where we start to move to a preventative healthcare system. And obviously globally that's important just for the people to live healthier lives. So rather than looking for early warnings and waiting for systems, we're trying to obviously predict earlier on. And as we start to then do that, we can then encompass larger data sets, obviously, start combining vitals from various systems and bring all that into play to allow people to live obviously healthier lives and also then start to gather more insights as well. So very much moving towards actionable steps earlier on for people living with conditions, I suppose, as well. And then obviously comes up with that the innovation in devices and things that allow people to do that. I suppose in terms of another way of thinking about it is probably patients being willing to share data as well. I think that's always a question as well in terms of how that manifests in various cultures and how people do want to engage with their own health as well as with the health system play locally for them. I suppose impact on health systems, if we're looking at AI, is obviously positive. Every system has pressures, and UK is not different to that with resources and budget constraints as well. So I feel more positives, but just some things to be aware of, and obviously using AI still needs human in the loop as well for effective implementation as well. So that's where I feel the role of remote patient monitoring and AI as well.
Yeah. Yes, that's good. Anyone else would like to point?
Larry. Yep.
Yeah, Larry.
Yeah, so I think Sanjay said a lot of what I was going to say. So I think fundamentally we have to go back to what the technology and the history that's enabled this, right? So a lot of this is around having large data sets and cloud computing, and obviously, people having things like remote monitoring and sensing in their hands. And therefore, the opportunity there really is around being able to use large data sets to be predictive, as Sanjay talked about, but also really provide that shift for us in terms of prevention. So for me, I think that's where the big changer is, the ability to go from a less reactive health system to one that's much more preventative. And that's both in terms of primary prevention as well as secondary prevention, and be able to kind of manage those conditions. I think there are significant opportunities for large health systems to do that. So, if we use cardiovascular disease, which I think is a helpful framework, the amount of people that you can actually monitor, both in terms of, their diet, their weight, and all of those other key factors can make a really significant difference. I think there is, so I think the big changer is that focus on prevention and early detection. And I think on that journey is where some of the risk lies as well. So the risk lies around, obviously, I think it goes without saying, around data security and data quality is also really important. But I think there is a risk in terms of how health systems are able to cope with this shift. I think this is one of the innovations where there is a natural pull where people are, there's lots of solutions in the market. So I think there's a risk of fragmentation, and there's also a risk for how health systems can adapt to ensure that we have the skills, but also the infrastructure to be able to provide this technology, which is growing faster and more rapidly than perhaps previous solutions.
Yes,
I think that connectivity is really key as well. I think at the moment there's a lot of fragmentation with systems, multiple EPRs, multiple solutions really as well. And you go into an exhibition hall of a conference and you'll see very much, a plethora of solutions, and there'll be a small tweak in each one. Ideally, yes, we'd like one solution, but that's not, realistically, that's not going to happen. But I think there needs to be some overarching system to allow some cohesion across the system, and purely for patient flow as well, and that consistency in care and continuity of care as well.
I think one thing that we've actually seen key with that, Sanjay, in the States is definitely the interest and the ability to have doctors put their brains behind the AI, understanding the workflow better than really kind of any just random engineer that's trying to build up the AI. And that really does mean that most of the time the doctor's going to have to be paired up with an AI engineer. What that does allow, though, is kind of understand the workflow and the fragmentation to a point where you can start to say, these are the obstacles and how do we avoid them? I think one thing that you can definitely see from monitoring the past versus kind of what AI is going to be able or allow us to be able to do is, in the past, we basically have been looking at graphs and diagnostics as basically in a rear view mirror if you're in a car. Kind of what past has been, kind of what is your grasp, but how kind of have your tests been, versus kind of being able to see not only just an objective measurement, but also a subjective measurement. And I think that's also where it comes in. And I think one of my the fellow panelists had mentioned this as well, the adoption not only by physicians, but also by the clients themselves, by the patients themselves. And I think that's one thing that becomes interesting is definitely a trust factor. They definitely don't want to come back to bite them medically, especially when you're talking, for us specifically, professional athletes, and it can come back to harm their amount of playing time. But when they start to realize that it is for their benefit, they're able to start to see the correlations that are physicians that are helping assist build this AI platform that we've built in-house to be able to really meet the cybersecurity measures. I think that's what's interesting to them, because then they can add in different aspects of their life that they're undergoing, seeing diet and different other behavioral markers that you can then add to the objective measurements and really be able to start assisting the doctors in creating this collaborative, predictive system that AI, I mean, really AI was around, 20 years ago? All it is really automation. But what AI can do these days, right, in the last 3 years is so much more, because its ability to compress data and be able to take just reams of data and be able to make something coherent from it.
Actually, that's a very crucial point. And we are moving from something which has happened, and here is the data, to something will happen, and here is the warning. And this is the key resource which all of us would be looking at, and especially when we are talking about predictive analysis and the remote patient monitoring moving into that scene. One example which I can think of is the shift in the heart failure care. So instead of just noting a weight gain, which is again reactive, the AI analyzes the combination of this today in the heart rate variability or sleep, the quality and the respiratory rate, etc., to predict the need for an intervention. And there are some things which can predict 3 to 5 days before the patient reports a symptoms. And this is an early intervention by design. And that is something which is really taking over, and that is something which is one of the greatest benefits which we can harvest from the RPM's AI in predictive analysis into that. So
I think there is also
yeah.
Yeah, and it's an interesting one. So I do also think there is also potentially the risk of overtreatment, right? So for the example you've just given us, a perfect example where someone can be detected and actually should be treated accordingly. I think there are some scenarios where we have to be careful in that people aren't overtreated, but also actually, particularly in the early stages, if you are using this tool, it actually will increase the healthcare utilization in the short to medium term. So, for example, if in Northwest London we were to give everyone some kind of monitoring device, we'll probably pick up a lot of people with high blood pressure that don't know they've got it. So then that significantly increases the workload in theory of, obviously it's the right thing to do, they should be treated, but I think then you have to have the system to be able to cope with some of those more early warning signs and kind of predictive factors. So if someone needs coaching with education or nutrition, yes, some of that can be done through technology, but also we have to have the people and the skills, and healthcare is still a social element, I believe.
Larry, I think that's also why it's so key to be able to build out networks across the world, especially as we were talking about earlier, right? Being able to have opportunities or working in other countries, that means to have kind of a workforce there. Of course, us working in the States does not mean that we're going to work with an EPL team. We're not going to be trying to say, okay, we're going to work from here. We're going to try to add on doctors in the UK. And I think it's interesting to see, and I think there's definitely that workforce capability alongside the abilities of what AI can do to be able to actually counteract in a bit the burnout of nurses or physicians if it's built correctly. Being able to share knowledge within different countries and being able to say, okay, this is how we maybe like kind of treat this. Now, this is our medical laws here. What is the medical laws in UK and Japan and Australia and yet whatever other country you're in, and being able to have the doctors work together and being able to kind of assist each other in the predictive analysis as well as the patient care. Because yes, there will be numerous more patients that will be, as you had mentioned, through AI being added to these diagnostics. There will be many more people that will be discovered to have underlying symptoms or chronic diseases from kind of even something as minimal as sleep as what we're working with, or straight off from the disease itself.
And another thing I would add, Larry, that you don't need to worry about is the systems are continuously improve themselves and adapt themselves, to be more accurate in such a way that, it will bring more value rather than the current, I would say, blur situation that we don't know what's going with the people.
Right. So somebody was mentioning here the data privacy issue, data security issue and all. So I just want to have a small this thing when we are talking about that. What do you think is the single biggest technological barrier outside of data security, which still needs to be solved to realize this predictive potential? Is there anything which you feel that is there, which is also as an obstacle? While patient's data, yes, overuse of the data, yes, those are things. Is there anything which is also a barrier which we are seeing that, okay, whether this whole thing can come into practice and connecting the patient to the hospital or the home and so on? Is there any such thing which you are seeing?
From my experience, is adoption. Bottom line, you need to have the ecosystem to adopt the things. Otherwise, all these things won't work.
Right.
So, and when I say adoption, starting with, of course, the patients, the people themselves, and of course those that are providing the care. So that's the key thing. And again, a good direction that I would say could solve it is, and I'm not saying that it's already solved, but to have a seamless way to solve this adoption issue. Like continue your normal life. Imagine a situation that you continue your normal life, but the relevant information is collected continuously without any involvement of yourself. And the analysis is done in the back office, and the decision and recommendations and the predictive are, coming out like any simple, I would say, recommendation.
Yes, you're right. I think technology can connect the patients to the hospital, but then the data highway is often blocked by many barriers. And so therefore, that is one thing which is very clear. One example which I can just think of is the digital paper chart problem. A predictive AI alerts the nurse to a high-risk patient, but to put on it, the nurse has to mutually log into 4 different systems. As I have seen in one particular case, the remote patient monitoring platform, the EKG monitor, the vendor's portal, and finally the hospital's EHR and the pharmacy system. So this is just to verify the patient's current medication, lab trends, and this fragmented workflow actually defeats the speed and efficiency of the AI, which has been promised in the first place. So this is one of the challenges to it. So quickly, I think we had a wonderful discussion on the number one thing. So let me move to the next one, where we are more now facing this increasingly, is that of the wearable tech and the biomedical engineers putting in their might, and the tech guys putting in their might to come up with solution to ensure that they are able to give some predictive tools which will help analyze, which will automate various things, including giving the final outcomes. So what do you think about the consumer wearables becoming clinical tools? What innovation in various things, whether it is biosensing or material or miniaturization of the whole thing, make data from these devices clinically relevant, trustworthy? And how is this going to change the entire doctor-patient clinical management systems?
Again, if I may.
Oh.
Okay, please.
No, go ahead.
Yes. So I think the best way to have a perspective about something is to get an experience out of it. So I do agree that there are currently a bunch of wearables that can collect, clinical information. But again, it brings us to the adoption. If we are talking about a person that has a reason, strong enough reason to wear a wearable for clinical monitoring. Let's take an example: a person that would like, to predict, I would say, cardiology deterioration. Okay, sometimes you need to wear something years in order to get this alert about, hey, you have a cardiac problem. So that won't be a drive enough to keep him wear this device and continuously maintain the device, like charging it, make sure that he wear it in the right way, etc. So that makes a quite problematic situation to have those clinical approved wearables bring the real value that are expected from them.
Yes, and I think one concrete example, another example is that of the continuous glucose monitors, which they have moved beyond just being a tool of diabetes management to providing metabolic health data that informs nutrition, lifestyle recommendations for the general public as such. And so therefore, we are fundamentally shifting the preventive care.
Sanjay?
I think that's interesting you said about CGMs, because that, there's a dual play here where they are obviously a fully regulated, medical device, authority regulated, and then also available to consumers. For example, athletes as well, who are using these sensors in the best way possible. But when we look at the mainstream consumer wearables, I think there needs to be some harder regulation on there. But equally, you could say they're useful for the everyday person who, whether you're counting steps or sleep or, things like that. But I think that, the CGMs have changed both patient compliance and remote care and personal sort of responsibility as well in looking after yourself. I think the data that they are gathering as well as people using on an everyday basis has been absolutely fantastic. And change a lot of people's lives whilst they live with diabetes, but then also start to manage their general well-being and different markers. I think, like Larry said before, we need to be careful, especially from the consumer wearables, where we start to open a big can, a big box of people that just maybe are worried well in the nicest way, who are just gonna. I think there's a common term called frequent flyers in the medical industry, where patients who naturally could manage themselves at home, but then obviously the doctor still has a significant part to play to treat these people as well.
So again, very much echoing most of what Sanjay said. So I think the opportunity here is huge, right? And I think we often absolutely have to embrace it. I think in a centralized health system, we do have private sector, but it's largely centralized in the UK, which I appreciate is different in other places. I think there is sometimes the risk with these solutions that we're not taking a very human-centered approach, and it's very much about the technology and the solution. So I think often with these cases, particularly if you were to do some risk stratification, there will be, the patients who you give them the tool, they can self-advocate, have high self-efficacy, they could just manage and go on. There will be some of those patients though who need a lot more input and support, and therefore the design of the solutions and the input that goes into kind of that coaching element is still really important. So sometimes it's a small number of people who also need a broader level of support in terms of workforce and design beyond the technology. So I remember doing some research a while ago where we gave people a Fitbit, which is, that's a few years ago, but just a watch to see if they increased their physical activity. Very simple. And actually those who had already had a high self-efficacy went away and did really well, whereas those with low self-efficacy improved for a little bit and then they stopped using it, or it stopped changing their behavior. So I think the tool by itself doesn't necessarily change behavior. There's often a lot of coaching and facilitation. And, in the UK, again, I'll speak to that market. We know there's quite significant factors that influence healthcare behavior. So deprivation, inequalities, lifestyle factors. Those people that often need more of that attention. Is something about how we support and make sure these are aids to the clinicians and they're aids to the population as well, to make sure we're doing the right thing.
I agree with you, Larry, on that. And I definitely think that comes back to Mickey as well, saying basically about how does the patient adopt it and actually want to continue using it. There's a lot of wearables right now that you get into diagnostics and they'll put them on a shelf in 3 months because they really don't do anything for them. They'll look at the graphs and be like, great, pretty graphs, don't really tell me anything. I don't understand what's the problem, why it's a problem from a medical standpoint. And I think there really is like the key of how do you get both the doctors to want to utilize it is really patient adherence and patients to be able to really want to say, okay, this is affecting me, and then getting that knowledge to the doctors in a way that they're, or nurse practitioners, or to the physician assistants in a way that they can actually handle it for soap notes or being able to go into a telehealth appointment or an actual in-lab appointment. But for the patient themselves to actually want to continue to adhere and to want to use it, it does have to be an immediate and sustained kind of change. They want to see, okay, if I do something or if I utilize this, will I actually see improvements? Will I be able to say, okay, because I'm implementing this in my daily life, which a lot of people, if they're not already implementing it, as you already said just now, a lot of people that you're going to start to introduce this as a new are going to be like, yeah, I knew it kind of showed me interesting data, but again, how do I utilize that data to really see change in my life? And I think that's one thing that's really interesting. And we've talked about this not just from the sleep standpoint, but also with cardiologists, say at Cedars-Sinai, or we've discussed with nutritionists, just numerous different areas of medicine to say, how does that then all affect each other from a sleep angle, from a cardiology, from a mental health, to say, how do we get someone to say, okay, because sleep health then does say affect cardiology, right? Then do we get the individual to continue using the device up front, want to see their change in life, see maybe a change in sleep health, or see a change in a seed that leads to another chronic disease that will then affect that chronic disease later on, which then in a positive way, you're actually affecting it earlier on.
I think Larry just touched on something very pertinent there in terms of health inequalities, and all good that tech does, it's got to be affordable, right? And the person and the social determinants and demographics have a large part to play in essentially bad health as well. But then you need to give this access to all the people that need it, right? And it comes probably back to the design element of the tech, or and importantly involving the person with lived experience, and the people that essentially at the end of the day, end of the journey of the product journey, they're going to be the end users. So I think that's very important to consider and address those postcode lotteries and those health inequalities right across the populations, whether it be UK or Europe or States, etc.
Brian brought out a very important point in terms of the trust gap. And so to bridge the trust gap between the clinicians and the data which they have, finally, the manufacturers also need to prove something, that their device accuracy against a gold standard, which could be there, which could be the US FDA cleared items or the demonstrated performance. So how do we how do we look at it? Is it that because the rigor of the consumer facing or the consumer promoted wearables versus that of a medical grade device, they vary significantly? Or if there is there a convergence or where a confluence can happen, and the trust factor in the wearable can improve either by an FDA approved thing, or the maybe the reports or the data or the personal experience. So how do we bridge this trust gap of the clinicians, so to say, for these wearables?
I think with trust, it's definitely, you need to stay aware of not just kind of what's going on in your country, but also the top level cybersecurity laws and regulations that are being passed. I mean, we don't have that in the States. We don't have the top level regulations. And so what is the top level regulation right now for AI is actually either the EU AI Act, is what definitely a lot of us in the medical community here believe. It's like IEEE UL 2933. We do see that if you can build your AI towards that, it's more like an SPF 30 at the day of the beach versus an SPF 15, which is more of what the regulations we currently have for AI regulations in the States. I think the other thing is definitely being able to stay in tune with doctors. And I mean, something as small as, say, a HIPAA authorization form, giving it to the client and just saying, hey, before you sign, like before you actually give us your data, we want you to sign this and say, okay, it's going to go to the doctor, go to who do you want this to go, information to go to, and we will adhere to that. we'll adhere to that document and say we're not going to pass that on to anyone that you don't want. And if it would help, say, for example, again, going back to professional sports, say they don't want to give it to their director of performance, their president of health, or kind of one of their trainers, we'll say, okay, the value is going to come down. But again, if that's your so choice because you're worried about playing time, then we're going to adhere to that. Typically they will then at that time, we have actually had a pretty great, probably 99% is given to our doctor as least. We've also noticed that that actually does then increase also the need to be, or their interest in giving that data to the individuals on their respective teams as well. So, I mean, something as small again as a HIPAA authorization form, or as kind of much more in depth in terms of regulations that are being passed around the world and trying to figure out if you have a feature on a digital platform, are you meeting the top standards, not just in your country, but another country that may have a better standard currently?
So just to build
So I
on,
think it's the outcome-driven evidence is what builds trust.
sorry, VSK. So yes, so I do think the outcomes bit, and it sounds like you've got some really good processes there, Brian. But in communities who have a deep mistrust for good reason, because of historic things that have happened, it's very difficult, right? And I think comes back to the earlier point made around implementation of innovation. So a while ago, I did some study where we looked at how much funding was put towards new technologies compared to how much of that funding was put towards the innovation and adoption. And it was a tiny, tiny, tiny fragment of that. And, part of that is not just what the solutions are, but I think there's something about who is sharing that information with those communities as well. So actually, I'm much more likely to believe something if it comes from someone who I trust who's using it, compared to if it's coming from a CEO of an organization, despite it being the same information and being completely transparent. So I think there's a lot of investment, again, perhaps more so for centralized health systems, but there's a lot of investment to be made around building that trust. And I think in terms of building trust, it's an ongoing action. It's not a one-off. And I think that implementation and adoption of good practice and continuous improvement is really key in enabling that. And I'll just say we probably have a lot to learn from COVID as well, right? So there's a the vaccines and all the stuff that's still playing out. There was a lot to be learned around that sort of experience that we probably should be taking into some of these solutions.
I definitely agree with that, Larry, and I think there is a key to being able to have individuals from a specific community be able to speak to that community. Having us basically almost a spokesperson that does say, I understand these are your pain points, and then being able to say, maybe they didn't trust it before, which makes them even more ideal. Or if they did trust it, why did they trust it? And then how did they come to trust it? Was it just kind of faith in the fact that it was going to actually be truthful and protecting their information, or was it actually because they did research or they kind of learned it from themselves and then they saw through time and kind of exposure, yes, this was protective of my information. But I do believe it completely, as you said, it needs to be someone from their direct community because it does mean more. It speaks more leaps and bounds when it is discussed to a patient group that is someone from that direct patient group.
Wonderful. So I think I will move to one very important point, which comes from the earlier points which have been discussed by Larry as well as Brian. And then we come to the topic of the personalized care. So when we are looking at and when we are moving to personalized care itself, we know that that requires more than just clinical data, right? It requires understanding of the patient behavior, as Brian said, the context in which it has to be put in. So how do you think what advice you would have to the people who would be designing something, thinking or seeing, how can remote patient monitoring technology be designed using the existing thing, whatever they are doing, but then how do you maximize or increase the patient adherence to it? And how do you bring that sense of partnership in their own care? So What do you think on that? So how can personalization be tailored, or how it can be made more adherence driven for the patient, so that the RPM can then be more successfully implemented, or it can be more, it can be said that yes, it has become successful in terms of what we are looking in the entire health equity system.
I think you have to look at that equity by design, and whether it's having it made available offline, because Wi-Fi and everything's not all the time. It's got to be affordable, got to be culturally sensitive as well. So then we need to look at all the different languages, and that's a massive thing. But and then the trust aspect is like we just touched on, in terms of having almost the expert patient type champions and advocacy through that as well. But again, it comes back to that involving and having that patient-centric approach very, very early, right from the start. So that's my thoughts really on it.
Yeah, from my perspective, I would suggest first to not bother the patient himself on the ongoing life, like, let him behave normally. And from the other side, once a specific condition happened, and our body is changing behavior along the time, either randomly or along the years. But once it comes to a certain period, just to interact in a I would say, friendly way with the residents, to understand better the situation, and to make a more accurate, recommendation, etc. So this the two things: normal, ongoing. If there is a special situation, just interact to make sure and to validate that the situation is right, and then to bring him a valuable outcomes to make his trust higher.
So I'd add to that and just say, and this is where I think AI and advances will be so powerful going forward. So a lot of the solutions at the moment have predefined outcomes or reporting, and I think there's something about, if I'm a patient, I probably will have slightly different sets of things that are important to me. So that question of what matters to you is really key. And Sanjay might have slightly different things that are actually more motivating to him. So being able to adapt the tool to be valuable to me as a user, I think will be key going forward, rather than a predefined, you're going to get these outcomes reported because that's what the healthcare system needs or wants. So I think that's a really important shift, which I'm not sure I've seen in a lot of solutions.
I agree with that. And I think the key here definitely is interoperability between numerous different areas. Being able to have not only the physician, but an engineer, someone from, say, the numerous different areas that you work with, so you understand, again, what the obstacles and pain points that they're going through. And then you're able to really create this closed loop AI system where no longer are the algorithms just kind of directly saying, like, this is what we should ask them from a medical standpoint, but also, like, how do the doctors, what are the clinical workflows that we want to actually get this information, or what type of even information are we wanting to get from the patient? And then actually have the patient say, okay, when I do answer this, when I start to trust this, that information flows in, it gets added alongside the objective measurements, and then we're able to really see something change. We're able to see immediate and sustained change. We're able to see that change. It's no longer just, oh, cool, I saw a graph and it was the same today as it was a week ago, even though I did XYZ different. Or a month ago when again, even worse, when it's a month and the graph has not done anything, has not changed drastically, or at least to them, it's like, oh, from a layperson's view, it's not changed. But I did so much more, and I took so much time out of my day to implement that. And I think that's when you really start to lose kind of that adherence by the patient, in which case then the doctors don't get the information that they need to be able to really diagnose and be able to treat.
That's right.
Yep.
So I think that's great, and I think thank you for bringing that human element to the forefront, because we understand that the most advanced technology is useless if the patient doesn't use it or doesn't understand it or doesn't feel the benefit of it. So that should be one major take-home point into this. And so therefore we can able to understand the behavioral nudges to improve the outcomes of this. So so lastly, I think we'll come to one of the thing which is a major one, which is the and how do we look at the future of the RPM and the healthcare system, the system to itself take on to the thing. So let's look at a little bit of the economics and the commerce part of it. So from a health system perspective, what are the biggest financial benefits, operational benefits, which any system will benefit from this proactively engaging with the RPM things which are available, tools which are available, which needs to be developed or can be developed or which are there. And how does this whole thing change in terms of ensuring that we are giving a continuous, sustainable care? And someone talked about the interoperable standards and other things to be set in. So how do you look at this as from the health system perspective, as the financial challenges or the operational benefits which one can get?
I think we're looking at the benefits of obviously avoided costs and reducing unplanned admissions and readmissions, maybe shorter length of stay as well, and then obviously having the advantage of releasing capacity as well by people being able to remote monitor. Obviously, the benefit on the population health as well as a whole, going back to our very first point of prevention as well. But I think also it has to change at scale to have that real impact. And again, that involves significant pathway implementation, and implementation is key. We touched on all the sort of cybersecurity and those regulatory aspects as well, which need to be addressed as well. And then obviously coming back to the health inequality piece and ensuring that all patients have the right access to the right care in that way.
And the ability to do those things is really important, right? So I think there is almost this paradigm shift that's often required. So we know prevention is the right thing to do. We know it's really key, but then being able to make those investments to say, actually, we're going to do this investment. We're not going to see a return on investment in quotes in the first year or the first 2 years, maybe, or even 3 years, but we know this is the right thing, and actually the outcomes will start to show. So I think there is that paradigm shift in terms of how decisions are made. There is also the likelihood that you probably have to, particularly in the state of some health system, you have to double invest, both in terms of removing your backlog and your reactive care, but also then doing that prevention work. And I just think so much focus is placed on seeing a return on investment in the short term, which is actually never realized, because we're then not making decisions, the right decisions for sort of long-term investment. And of course, there's all the other points that have just been made around implementation and so on. So for me, I think that's that real paradigm shift, moving things. And if you think about what the drivers are for high cost, it will be, your long-term conditions. The cost of a stroke is really high. So actually, if you start to really address those underlying downstream factors, and also the cost of hospital admissions, being able to kind of do virtual clinics and all the things that we know are happening here, then you start to see real reduction, but also better experience and outcomes for people.
And I think really quick to add on, in agreement with you both, Larry and Sanjay, and I think in sense of for a financial thing as well, for the insurances side, I know in the States, it's definitely more of a value-based care model. I think definitely understanding insurances around the world is definitely a key as well. But I think from this value-based care, right now, I think what we're really trying to get accomplished is really work with the lobbyists in DC to be able to figure out how do we draw CPT codes to the utilization of AI and actually have a functional AI where it has a medical purpose and is not just there to basically for fun or to kind of learn about something anew, but it actually does serve a medical purpose to be able to assist not only the doctors, but also get medical information for that sustainable change for the patient.
And I would add, moving from qualitative to quantitative measurement. We see nations that are already changed their reimbursement system from qualitative to quantitative.
Definitely agree.
Right. So I think we are slightly this one. We have had talk on the future, the AI, the patient's involvement, the thing on how the consumer as well as medical grade variables, and how the remote patient monitoring, whether either through a nudge you improve the behavioral aspects, or you try to put something like reduce the readmissions and all those factors which are there. So just in conclusion, I would like to each one of you look through the maybe a crystal ball and or gaze and try to say that in the next 5 years, what is the single most significant outcome you would look at, whether it is clinical or economical or behavioral, where you predict that the remote patient monitoring will deliver? And how will that impact the relation between the providers, payers, and patients? And what will be the outcome? So 5 years later, how do you see this RPM ingraining itself into the healthcare system?
I'm happy
And
to
I
start.
want comments from each one of you, maybe
Yeah,
one
I'm happy to
line or
start and
one.
say,
Yeah.
and so for us, I think it's already here, right? It is happening. So we have remote hospitals, we have remote monitoring for some conditions. I think in 5 years' time, where this will be is a much more broader adoption. So rather than a few really high performing health systems doing it, that hopefully it's all health systems, rather than it just being focused on those very high risk patients who are repeated attendees, having remote monitoring that is more accessible. To Sanjay's point as well, more accessible to everyone to some extent, and making sure that's affordable for those people. And hopefully it will, well, not hopefully, for sure, it will be at a point where the continued growth in AI technologies would hopefully make it much more interactive and therefore improve some of that behavior element, so patients can become much more activated and much more engaged in their own healthcare, much more proactive. Obviously, in order for that to happen, health systems again have to have the infrastructure, whether that's the data infrastructure, but also the computing power, I guess, to be able to do this in regulated environments.
I think the economic impact will be the most, huge, will show huge change, huge improving its efficiency, because it's not just predict in order to not take, I would say, expenses with no reason, but also if it actually detected and managed by follow up the outcome, and then come to a conclusion saying, okay, things were solved. So all these things, and again, with minimal human involvement, right? Because we have all this loop closed. So that will show a huge impact on the economy.
And Summonology, we see it as a 3 years in the future, and whether it's more of a dream or whether it's actually, and we really do hope it's a dream reality, is proactive, personalized, and predictive. We do think if interoperability between the healthcare systems, top levels AI engineering, as well as communities, are able to understand the pain points, which we think they do, and really be able to work together and be able to build such AI platforms, we do think there will be a world in 5 years from now that will be able to really hit home on personalized medicine, that will be able to predict early outcomes and be able to hopefully start to quell the numbers of chronic diseases.
I think for me, it's about moving to that value-based model. And I suppose in a summary, in a short way, remote patient monitoring become actual service rather than just a digital app or a gadget or a medical device. So yeah, whether that takes 5 years or 10 years, I'm not sure. But
Thanks a lot. And I think Venkat, you should also probably share your perspective on how it will look like in the next 5 to 10 years.
Sure. Yeah, I think that was very instrumental in trying. This whole thing is quite instrumental in shaping the thoughts of the healthcare professionals at large. In multiple areas who are building many things to ensure that they reduce the burden of the hospital system, which in any case, in many of the countries we see is moving towards, I won't say it is collapsing, but it is a little bit broken here and there. But if it is still the common thread from what we have all discussed and from what I feel personally, the single most significant outcome of this RPM, maybe in the next 5-10 years, is it isn't just one of any of these things which we're talking about. It is which we have talked about, the multiple, whether it is the patient, it is the clinical, or I believe it is the convergence of all the three things which is there. And basically at the center of it is the care. So it's a dominant care model which is emerging. It's a game-changing outcome, right? It will normalize the hospital at home sort of thing model, you may want to call it, for in chronic care management. Acute will still require a different approach, but we are all dealing with more chronic and non-communicable diseases, which are actually debilitating the entire healthcare system. So in 5 years, RPM won't be a separate program. I think it will be a default, what is today in design, it will become a default infrastructure for managing these things. And they will finally allow the health system to deliver value-based care, as one of the gentlemen just mentioned. And this value-based care will be at scale because clinically, AI-driven prediction or the variable data will allow us to manage conditions like the most important one is the heart problems, or COPD, or the diabetes, which has already reached a significant stage. And there we see a quantifiable reduction in hospitalization. So examples have shown that somewhere upward of 70% has been the reduction in hospitalization. Economically, this will prevent the shift from maybe, I don't know, millions or billions of dollars from expensive reactive patient care to a cheaper preventive remote monitoring care, so that this inpatient care, which is normally a reactive thing, will become something which will be preventable. And so therefore the business model itself become financially sustainable. And from the patient's perspective, patient will no longer fear going to the hospital. That should be the aim. They will be highly engaged, and should also be empowered to take control of whatever they feel about their own health through various methodologies. So RPM, fueled by majority breakthroughs which are seeing, will transform the healthcare from a place where we visit when we are sick to something where we feel that, yeah, this is a place where we can simply go and then we'll find a good support system. So this is what I feel as far as the RPM and the importance of RPM in the next 5 years in the healthcare system.
Thank you. Thanks a lot, Venkat. I think this panel has been really, really fantastic and insightful. And I know that we are slightly over time, but I did not want to interject because the conversation is so phenomenal, right? You all shared a lot of interesting insights on how healthcare ecosystem is evolving, especially the remote patient monitoring. And now it's time to transition a bit. So from sharing insights to listening to the startup pitch from Mickey, the CEO and founder of VitAlerter, Vicky will do a quick 5 minutes presentation, and then we will ask a few questions to him on the solution and traction. Mickey, please go ahead quickly.
Do you see my screen, my presentation?
Yes, please. Go ahead.
We took these issues to certain, I would say, problem with aging. So who benefits from VitAlerter? Nursing homes, aged care facilities, skilled nursing homes, assisted living home care, and hospitals. Some of the challenges. 2024 shows about 400 missing nurse care in the United States. Talking about residents, high incidence of falls, like 3 to 5 per 1,000 per bed per day. Pressure injuries, 5 to 15%, and of course, unnecessary hospitalization. And the current solutions are reactive, manual workflow, and traditional tools, which we put wearables cameras in. And the way that VitAlerter is addressing it is like offer a seamless solution. We have developed a contactless biosensor. You can see in the camera, this small biosensor, which actually, by attaching below beds, which are sofas, you can see in the picture here, the furniture became smart. So resident, they lay in bed, nothing need to be weird. His vitals are collected, including continuous heart rate, respiration rate, heart rate variability, stroke volume, motion pattern, etc. The device doesn't require any infrastructure, but just Wi-Fi, and the data, streaming data, sends to the cloud. In the cloud, we have a machine deep learning algorithms that build patient's personal profile in order to predict the patient deterioration and allow staff members accessing any mobile app or any web browser to pre-set up a personal alerts for every resident. And from that point, the system will pre-alert in order to prevent such deterioration. So what are the unique features? Some of the unique features are imminent bed exit, in, out bed, posture change, automated management, heart rate, respiration rate trend. We have centralized monitoring and the deep report abilities to the management in order to improve safety and efficiency. We have providing an automated cycle, which is a composition of, again, the underbed device plus this smart tag that the staff members are wearing. And let me give you an example. Let's say this resident does have a problem at nighttime. So the system will predict, alert the staff on duty or even family members. And once they come to provide care, the system will make sure that this care is provided in an accurate manner and also record it in the management system. So no need for any errors or any wired aspects. So the proactive care safety applications that we provide are fall prevention, bed occupancy management, bed exit, away from bed, daily sleep quality, wandering, and automated posture change management. The digital management allows to pre-set up the whole patient's day and night activities and objectively and automatically make sure that those activities provided in the right manner. So the key benefits are enhancing resident safety, improving efficiency, and also compliance by automated documentation and quality of care for residents and improve family trust. Worldwide, we currently deployed in 16 countries, 160 customers, and in the UK, there were a real-world evaluation that run by the NHS, which shows a significant reduction of falls, significant reduction of manual turns, and either a quantitative and qualitative outcome, and they put us in their reimbursement system to provide the solution all over. In the United States, we already roll out the 10,000 beds with the key leaders and also collaborated with the compliance companies to make sure that the deployment process and adoption process will move largely. So why wins over Vitalytic wins over other alternatives? It's contactless, it's predictive, fully integrated. We have an API that can integrate to any existing EHR EMR systems. No patient burden, no need to attach anything to the residents, SaaS model, and already validated in 160 facilities in 16 countries. So we are transforming elder care through predictive automation in order to have a safer life for the patients, empower staff with smarter operation. Any question?
Thanks a lot, Mickey. We can take a few questions, and as I always say in these panels, the questions don't have to be soft. You could be brutal, you could ask difficult questions, give direct feedback to Mickey. So please feel free to unmute yourself. Yeah, Venkatesh.
So does this have to be integrated into the HIS of the hospital system, or is it a separate system?
As you can see, this is a dashboard. So it can be used as a separate system. Like you can see here, each of this block is a resident, and you can see the whole life cycle of the resident, including what are the activity need to be done, or what are his behavior, and any alerts that is a real-time alert that happened, it appears here, and appears also through the staff mobiles or through a user watch that can vibrate and alert them. But we have an API that connected to EHR system in order to release the needs for manual paper errors, etc.
Yeah.
Thank you, Venkat. Any other questions?
Have you started operating in in US or the UK and the other parts of the world?
Yeah, we have two offices actually. One is also in China, okay, to provide services to the Chinese market. And we open now also a new one in Singapore to approach the Southeast Asia. So we are quite, expanding strongly, not just US, but also to Southeast Asia.
Are you available in India?
I think soon we'll have, because our partners are native Indian, so they probably will bring their network and experience quite fast. And of course, we'll be more than happy to collaborate with you, Venkat. We appreciate your long experience.
Yeah, well, good to hear that.
Okay.
Any insights, any guidance on the go-to-market strategy, or on the product roadmap, or on the distribution channels from anybody? Okay, I think that's it. Do you have any final slide or any final thing to show, Mickey, before we hang up?
Yeah, so of course we are looking for partnering, various types of partners, either distributors, key leaders, in order to bring this innovative solution to millions worldwide.
Thanks a lot. Again, thanks to all the panelists. Really appreciate your time today. Really appreciate the insights that you shared. I think Venkat did a fantastic job by being such a fantastic moderator. He made it extremely organic and easy conversation. So really appreciate that, Venkat. And again, I think this is just the beginning of this relationship. I'm sure that we will find more opportunities to connect, collaborate, and support each other. So if you have any synergies that you expect or that you want to explore, let's reconnect. Yeah. Thank you, everybody, for your time today. Really appreciate it.
Thank you, everybody.
Thank you very much.
Venkat.
Thank you.
And we'll talk soon. Take care. Bye.
Have a nice day.